Good morning.
Good morning.
It's an honor to join you here in Nairobi for this Africa Health Business Symposium convened under this powerful theme, Powering Impact, Sustainability, and Economic Growth in Africa. This platform is exciting as it brings together leaders across government, industry, development partners to address some of the most critical areas and pillars of Africa's future: financing health systems, strengthening pharmaceutical ecosystems, advancing universal health coverage, harnessing digital innovation, and importantly, accelerating diagnostics for stronger health systems. This is not just another conference. It's a strategic convening of decision makers focused on unlocking investment, scaling innovation, and building resilient, self-sustaining health systems across Africa. And today's session, Detect Early, Treat Better, goes to the very heart of that ambition, because without diagnostics, none of these goals can be fully realized. Africa stands at a remarkable point in this health journey where we have expanded access to medicines, strengthened disease control programs, and improved health outcomes across many countries. Yet, as highlighted in this symposium's framing, access to timely, affordable, and quality diagnostics remain uneven, leading to delayed diagnosis, preventable deaths, and inefficiencies across our systems. Today, 70% of clinical decisions depend on diagnostics, yet only 3 to 5% of health budgets are allocated to diagnostic services. This disconnect is one of the most important structural gaps in our health systems, and it is also one of the greatest opportunities. What makes this conversation even more critical is how diagnosis intersects with every major theme of this symposium. Financing health futures. Diagnostics is a high return on investment opportunity. Pharmaceutical ecosystems. No effective treatment without accurate diagnosis. Universal health coverage. No quality care without diagnostics access. Digital health revolution. Diagnostics is increasingly data-driven and technology-enabled. In other words, diagnostics is the thread that connects all the pillars of Africa's health transformation. The adoption of the World Health Assembly Resolution WHA 76.5 2 years ago marks a defining moment of global consensus. For the first time, countries agreed to integrate diagnostics into national health plans, develop and implement national essential diagnostic lists, expand equitable access to diagnostic services. But as we reflect here in Nairobi today, this resolution should not be seen as an obligation, it's an opportunity. It's an opportunity to rebalance health investments, to strengthen preparedness, to build resilient data-driven systems. What is particularly encouraging and will be reflected in the voices of the panelists that will come after me is that Africa is not starting from zero. Across the continent, countries like Senegal are scaling up manufactured diagnostics to tens of millions of tests annually. Cameroon has built ISO-accredited labs and advanced biosafety infrastructure. Nigeria is pioneering cancer genomics and innovating financing models. Regional leaders are advancing collaborative networks and regulatory harmonization. These are not isolated successes. They are proof that Africa has the innovation, the leadership, the momentum to build a thriving diagnostic ecosystem. What we now need is scale, coordination, and sustained investment. At the center of this transformation is a practical tool, the WHO model lists of essential in vitro diagnostics, or in short, commonly called the EDL. The EDL enables countries to prioritize the most impactful tests, guide procurement decisions, and strengthen equity in access. National adoption of the EDL is not just a technical step, it's a strategic investment in more efficient and more equitable health systems. Diagnostics is fundamentally about the patient, safety, and trust. Without it, diseases are missed, treatments are delayed, and outcomes worsen. With it, we detect early, we treat better, and we save lives. Let us speak clearly to the investment community gathered here. Diagnostics is not a cost center. It's a growth and productivity driver. The evidence shows that in South Africa, molecular diagnostic programs delivered a return of $13.9 for every $1 that was invested. Diagnostics reduce waste, they improve efficiency, strengthen workforce productivity, and enhance economic resilience. This is the case that we must take forward from ministries of health to ministries of finance. And here in Kenya, from the cabinet secretaries of health to finance. So I cannot end this talk without emphasizing consideration of the African context. Improving point-of-care diagnostics is critical in expanding timely, adequate, and equitable healthcare access in resource-limited and hard-to-reach settings, particularly across Africa. The success of rapid diagnostic tests in diseases such as malaria, HIV, TB demonstrate how decentralized, easy-to-use technologies can enable frontline community health workers to deliver accurate results quickly without reliance on complex lab infrastructure. To maximize impact, countries must prioritize diagnostics that are fit for purpose, robust, affordable, and maintainable within local contexts, while incorporating innovations such as solar-powered equipment for off-grid settings and artificial intelligence to support test interpretation. Just recently, we were informed of AI-powered X-rays, how that has really helped to improve diagnosis for TB at lower levels where you have lower professional cadres. These technologies must be embedded within strong systems of quality assurance, regulatory oversight, workforce training, and reliable supply chains to ensure consistent performance and trust at the last mile. Ultimately, aligning diagnostics solutions with the real-world conditions will strengthen health systems, accelerate clinical decision-making, and sustainably improve health outcomes. Distinguished delegates, this symposium is about powering impact, sustainability, and economic growth. Diagnosis sits at this intersection of all three. So as we move into today's discussion, let's focus on scalable investment models, stronger public-private partnerships, local manufacturing and innovation, integrated, resilient health systems, because ultimately, Africa's future will not be defined on how much we treat, but by how early and how accurately we diagnose. The mandate is clear, the evidence is strong, the momentum is building. Now is the time to act. I hope this inspires you to listen to the upcoming panelists. Thank you.